my wonderful TM joiners. I'm Priya Mistry, the TMJ doc, and this video is about ICR, Idiopathic Condylar Resorption. Many of you over the years have reached out to me and asked me to do a video about this. It is not a condition I see frequently. It is quite a rare TMJ condition, but it's still out there. And I definitely wanted to make this video, and I will be making one that compares idiopathic condylar resorption to osteoarthritis. So keep an eye out for that video, as it'll be out probably in the next few months at some point. Don't forget to hit the subscribe button so you get notifications for when my new videos post. Watch this video until the end for all the information on ICR and more. I've added a segment to most of my videos called Highlighting a TM Joiner, where I pick a comment from one of you and highlight it and give my response. So feel free to leave a comment below and maybe you'll get chosen for one of my future videos. Before getting into it, be sure to check out my social media. I'm pretty active on Instagram and TikTok, not so much on Twitter, and I try to update my website blogs every now and then. I'm not great at that either, but keep an eye on those because there is a lot of information when you combine them all. So if you're on a search for TMJ information for yourself, for a family member or a friend, check out all of those as there's tons of information spread out amongst them. A quick update for everyone. I am selling these facial rollers on my website. I've linked it above as well. These facial rollers are really great for massaging knots out of the masseter muscles, which if you're watching this video and you have TMJ issues, you likely have knots or bands of tight tissues in these masseter muscles, and massaging them out can be really helpful in terms of relieving jaw pain and headaches. These can also be used on the temporalis muscle. I've made a video on how to use these, which I've linked above as well. So be sure to check them out. If you'd like to get a pair, just go to my office website and buy them from the shop there. For those of you who don't know me, I'm a general dentist with a practice in beautiful Vancouver, Washington. At my practice, we are dedicated to taking care of those with TMJ disorders. I have noticed that while a lot of you are watching, not all of you are subscribing. So please take a moment to hit that subscribe button so that these videos are pushed a bit more. If they're pushed more people who are in pain will find them and hopefully get some relief and help. So let's get right into it. What is idiopathic condylar resorption, or ICR? To fully understand this condition, it's important to first have at least some basic knowledge of the anatomy of the jaw joint. So let's start by reviewing that. The jaw joint is made up of two bony components. The temporal bone is the upper bony component, and the little bony knob that the jawbone ends on is the lower bony component. This bony knob that the jawbone ends on is called the condyle. So it's very important for you to remember that. Again, the little bony knob that the jawbone ends on is called the condyle, and we'll be referring to that sort of all throughout this video. Between the condyle and the temporal bone sits a little disc of tissue called the articular disc. This is made of cartilage. Now let's define some terminology. Idiopathic condylar resorption. Idiopathic is used when describing a condition that arises out of the blue and for which the cause is unknown. Condylar refers to the condyle, again, the bony knob the jawbone ends on. Resorption means the absorption of cells or tissue into circulation. So ICR literally means that the condyle is being reabsorbed by the body. So the bony knob the jawbone ends on, the condyle, is being reabsorbed by the body for no apparent reason. Idiopathic condylar resorption. This resorption can occur at a slow rate or it can occur very quickly. And again, the exact cause is unknown. It's suspected that trauma, hormones, clenching and bruxing activity, and or prior orthodontic treatment or braces can play a role. ICR is a diagnosis of exclusion, which means that all other diagnoses and conditions have been ruled out before idiopathic condylar resorption is diagnosed. During ICR, as the condyle breaks down and is reabsorbed, an open bite can occur in the front and the facial structure can really start to change. This can happen quickly or very slowly. About 75% of those with ICR will also experience muscle pain and joint dysfunction. This includes headaches, jaw pain, clicking or popping noises in the jaw joints, and or jaw locking. You can see the progression of ICR in the images here. Because of the pain, the bite changes, the changes in the facial structure, and the jaw joint dysfunction, ICR can be truly life-altering. Fortunately, it's not nearly as common as other jaw joint disorders, and I've really only seen it once in my practice. Thank goodness. Idiopathic condylar resorption is seen most frequently in females between the ages of 10 and 20 and right around the pubertal growth spurt. For this reason, ICR is also called cheerleader syndrome. Diagnosis of ICR involves symptoms, a thorough history, a thorough examination, cone beam computed tomography or CBCT scanning, a bone scan, and more. To diagnose ICR, I would say the more tests, the more imaging, the more everything, the better. Treatment for ICR can vary from no treatment to surgery. It truly depends on how much the bite and the facial structure have changed. As the facial structure changes and the jaw typically goes further and further back, it becomes more retruded. That can truly affect the airway and can cause or exacerbate sleep apnea. Rapid progression of ICR can cause or exacerbate other issues as well. Treatments include, but are not limited to, anti-inflammatory medications, TMJ physical therapy, TMJ orthotics, massage therapy, braces, condylectomy, or orthognathic surgery with total joint replacement. The latter two that I just listed off are surgical treatments. And for the more extreme cases of idiopathic condylar resorption, those are typically what's needed. As a side note, I want to make it very clear that idiopathic condylar resorption is not the same thing as osteoarthritis. Those are two very different conditions. So let's recap. What is idiopathic condylar resorption? What causes it? How is it diagnosed? And how is it treated? Idiopathic condylar resorption is when the condyle breaks down and is reabsorbed into the body. It breaks down and the cells re-enter circulation. Its cause is still largely unknown, but may be related to hormones, trauma, past orthodontic treatment, and more. Diagnosis involves examination, imaging, bone scan, photographs taken over time, a thorough examination, bite analysis, and more. Treatment includes just monitoring if it's progressing very, very slowly, or it can be as extreme as surgery if it's something that's progressing quickly and affecting the bite, the facial structure, and more. I hope you found this information helpful. Now let's move on to my segment highlighting a TM joiner. This week, I've chosen to highlight a comment from @DisturbedYoYo. My office staff and I love your username. @DisturbedYoYo said, I've watched countless videos on this in the past week, trying to relieve or ease the pain of my jaw being out of place. Yours is the first one that actually explains properly what I'm supposed to be doing and what it feels like, so I know I've got the right spot. Thank you so much. My jaw unlocked straight away. Now I just got to figure out how to get the disc back in place and realign the jaw. Thank you. This comment was on my video called Releasing the Lateral Pterygoid. Releasing this muscle can help reduce pain and increase jaw range of motion. You can do this on yourself by checking out the link above and below. A little message to @DisturbedYoYo. The best way to get the disc back in alignment and get everything back into proper alignment is to get a TMJ orthotic from a skilled and experienced TMJ dentist, and also find someone who does some craniofacial therapy. These are muscle releases and osteopathic jaw manipulation that also help bring things back into alignment. For more information on how I treat TMD, please watch my video, which I've linked above and below. So that's really it, my friends. Again, I'm Dr. Priya Mistry, and I hope you found this information helpful. If so, please feel free to like, subscribe, and share with your family and friends. If you're looking for pain relief from the comfort of your own home, please download my free PDF guide called 3 Steps to TMJD Pain Relief. You can find that on my office website on the homepage if you scroll all the way down. Please feel free to leave any questions or comments below. I am still responding to all of them. It's just taking me some time, so please be patient. And remember, my friends, you can never have TMI about TMJ. Thank you.
Loving you, yes, it's so hard.